Point quickly. So there are lots of other supplements that I think can be really valuable. I think B vitamins are very important, especially methylated B vitamins. Vitamin D is very important. Many people, I think, don't have sufficient levels of vitamin D. I think the data on vitamin D, we could do an entire podcast on that. The clinical trials looking at vitamin D levels are really poorly done clinical trials. And so I think if a person looks out at the literature and the literature says there's no evidence that vitamin D really helps, I would argue pretty strongly that those trials haven't asked the right question and weren't designed correctly. So my view is it's better to probably err on the side of caution and make sure your vitamin D is probably somewhere between about 40 and 60. And if you're not achieving that through natural exposure to sunlight, which many people are not, then you're probably better off supplementing. There are a couple of other supplements I really believe in, and I think magnesium is a very important one. And I think you have to be thoughtful about the form in which you take magnesium. So you can take magnesium in a slow absorbing form or a fast absorbing form that's poorly absorbed technically. And I think we need both, right? So I think that like a poorly absorbed magnesium would be like a citrate, glycinate, or oxide. And those actually really help with bowel regularity. So for anybody who's a little bit constipated or just, kind of needs to be a little bit more regular, we always want to have in anywhere from 200 to 500 milligrams of one of those forms. Conversely, I think virtually everybody also benefits from a slow absorbing form of magnesium. The brand that I like is called Slow Mag. Again, I don't have any affiliation with any of these companies unless I'm disclosing it as I did with AG. That actually, most people, if they notice, I have a little bit of cramping sometimes, or, I'm getting little palpitations called PVCs sometimes, those get a lot better with magnesium supplementation. So I think most people benefit from that. There's another type of magnesium that I'm a fan of called magnesium L-threonate, which is magnesium paired to a transporter that gets the magnesium into the brain. I think there's reasonable evidence. I wouldn't say it's incredible, but I think it's quite good that magnesium L-threonate is beneficial to the brain and might even have some capacity to reduce the risk of dementia. Before bed, I tend to rely on ashwagandha, which I believe you said is in there. So I take a big dose of ashwagandha and glycine. And again, I take that magnesium L-threonate, and those are kind of things that I think help with reducing cortisol and making it a little easier to sleep. Then the final supplement that I do think most people benefit from, and there are probably many others, but I'm just sort of going through a few that I can think of, would be fish oil. So most people probably don't consume enough marine fat to get what I think are ideal amounts of EPA and DHA, which are two very special types of fats called omega-3 fatty acids. And EPA and DHA, I think the balance of evidence is quite strong that they're both beneficial to the heart and the brain. EPA probably a little bit more for the heart, DHA probably a little bit more for the brain. I take a brand that I've had tested because you always want to be careful about contaminants here. And it's made by a company called Carlson's. Again, I have no affiliation with them, but I take their EPA and DHA daily as well.
That's a fantastic summary for anyone who's looking. I take all those things.
Yeah.
I think that's a brilliant summary. And I really hope everyone who's listening and watching, get those checks and tests done and grab those supplements. Because again, I like what you're saying, that it's all about erring on the side of caution, right? It's almost like protecting yourself, being safe, rather than assuming that A, you get this, or B, it doesn't really matter. Is it that we used to find these supplements in other forms before, or as humans, have we always ignored this and now we've suddenly figured it out? Or has our lifestyle just got so stressful and intense that we're needing more of all of this to support the pace at which we're moving?
Yeah, it's a great question. I do think that the supplement world is such a slippery, dirty world that I always want to throw out a disclaimer, which is when I talk about these things, I'm also very diligent about the brands that I buy. So again, I have no affiliation with any of these entities, but having looked at third-party testing, I find the brand Jarrow, Jarrow, the brand Pure Encapsulations to be two of the most reputable companies out there. So I'm basically always going to try to buy from them if I can, even if I'm paying a little bit of a premium.